Good afternoon. Thank you for joining me for the November 2025 edition of Aging Matters, sponsored by the Berks County Area Agency on Aging. My name is Jessica Jones, and I'm the Executive Director. With me today, I have Kristy Killian. Kristy is a volunteer with one of our contractors, Berks Encore, and she is here to talk to us today about a really important topic, open enrollment. And she has a role as a volunteer with our PA Medi program. So welcome, Kristy.
Thank you. Thank you for having me.
Sure. Can you tell us a little bit about yourself before we kind of get started and jump into all these questions?
Sure. My name is Kristy Killian. I've been a volunteer with PA Medi for about 3 years now. I do the monthly Medicare 101 presentation to help people familiarize themselves with what's coming up. I have a son currently at Penn State main campus in college, and just here to help any way I can.
Excellent. Thanks so much, Kristy. This is a really important topic, and I think, when I think back to my mom and when she had retired and having to make some decisions around this. At that point in time, it was very overwhelming, and it's just such any sort of information we can provide to our listeners, and then later on we can talk about how people can contact Encore and get hooked up with a volunteer to talk about specifics in the PA Medi program and how it can help. But today I just wanted to sort of give a big overview of what PA Medi is, and then if there's any more information that you think we need to add at the end, certainly feel welcome to do so. So let's talk first about the open enrollment, the deadlines, the process. When exactly does the open enrollment period start and end, Kristy?
Okay, so the open enrollment is going to begin on October 15th, and it runs through December 7th. And what will happen is the new plan that you choose will become effective then January 1st.
Okay. And then if I were a consumer and I was making these decisions, how would I enroll, or if I'm already enrolled, how do I go about making changes to my Medicare supplement plan?
Sure. So there's 4 main ways that you can make these changes. You can go online to Medicare.gov. You can give us a call at 1-800-MEDICARE. If you find a plan that you like, you can go online and apply directly through them by either online or through a phone call. The thing that I like is give us a call at PA Medi, the local office, and we can set you up with a one-on-one counselor that can go over your specific needs.
Okay. So when you say the local office, then you mean Berks Encore, contacting Berks Encore directly at their number. What is that, 610?
It's 610-374. 3195, extension 209. And something that's really nice, Jessica, is we have 6 locations throughout Berks County, Reading, Fleetwood, Shillington, Wernersville, Douglasville, and Strausstown.
So those are the senior centers?
Yes, ma'am. And we offer counseling as well sometimes out of those centers.
Nice.
So if you're throughout the county, and you can't make it into Reading, or you want to see somebody in person, check to see if any of those other local centers have the counselors available for you.
Okay, great. So can you talk to me a little bit about what should I be choosing during this period of time? What should I be thinking about and choosing?
Okay, so this is the time to make sure that your current plan is lining up with all of your needs. So you want to make sure that your providers are still in network, all of your drugs that you take are covered under your prescription plan, and you also want to compare the cost. Make sure you're getting the best for your money.
Okay, so when you say when I'm making sure that my plan is still participating, how do I do that exactly?
Well, what you can do is, again, you can create your account online at Medicare.gov.
Okay.
Or anytime you have any questions is to just set up an appointment with the PA Medi counselor. That's what we're there for. We provide free and unbiased advice. And basically, we'll compare what is available to you based on your health conditions.
Okay. And so when I'm making those choices, I'm creating that online version, on Medicare.gov, you said. And then once I'm talking to the volunteers, when I'm coming in to see the volunteer, is there specific information that you recommend that I have with me when
Absolutely.
I go in there?
I recommend bringing your Medicare card as well as a complete list of any of your prescriptions that you take, along with the dosage and the number of times per day. What we'll do is we'll be able to enter this into the system and see which plans offer coverage and at what cost. Now, keep in mind, if you are currently enrolled in Medicare, at the end of September, you should have received an annual notice of change. This is going to tell you specifically in your plan that you have now what changes are taking place. When you take a look at this page, see if it's something that works for you. You don't need to do anything. It will automatically renew for you.
Okay.
But if you want to make the changes, that's where I highly recommend making the one-on-one appointment with a PA Medi counselor.
Okay. There's always one thing that I think is important to address too here, because you hear about your Medicare, and you have your traditional Medicare, and then you have your supplemental plan, which is what we're talking about here. But then I hear things about these Medicare Advantage plans. So explain to me exactly what is a Medicare Advantage plan and kind of the circumstance and why I would potentially choose one of those.
Okay, so the easiest thing for me to do is to start out by saying there's two ways. You can have original Medicare or a Medicare Advantage plan. Original Medicare, you're going to have your Part A, which is your hospitalization, your B, your medical, as well as your standalone Part D drug in most cases. Now, there's no out-of-pocket maximum with original Medicare. A lot of times people, to help themselves financially, will bundle that with a Medigap policy. So you have original Medicare with a Medigap policy. On this side, you have your Medicare Advantage plan. And what they do is they more or less bundle all of the parts, your Part A, your Part B, and your D, which is your drugs. Now, a lot of times what you'll find with this is you're going to have to stay within network. You have a certain list of providers that you must see. It's not going to be like original Medicare, where as long as they accept Medicare, you're good to see them.
And then let's say this year I choose a Medicare Advantage plan. Am I always locked into that? Do I have to continue to do that? Once I make that decision, is that like it and I can't make any more changes?
Absolutely not. So there are times throughout the year that you will be able to make the changes. The key is to finding the times that benefit you the most to prevent any type of penalties. So what we're in right now is a Medicare Annual Open Enrollment from October to December. This is where you can change your plans. And if you miss that, there are other opportunities, including special enrollment periods if you would qualify. If something would happen in your life that would cause you to need to change a plan, we can take a look to see if we can do that as well.
So like an example, I'm thinking just for the viewers to understand, maybe a change or something in life, like perhaps it would be a full retirement or something that they no longer, would that be sort of considered a qualifying type of event?
If you move, yes. Your qualifying event for retirement, of course. Another one, when you become eligible for Medicare at 65, you have that 7-month period. Going into a nursing home. Anything along those lines. Now, you can also, if you have some type of circumstance, reach out to us. We can check out as well if that will qualify.
Well, and so it's just really important to understand that there's some levels of things then, from what I'm kind of hearing from you, you're sort of locked in, but not really. And, you know, you have your open enrollment period, but if other life circumstances happen, then there are ways to work with that. Okay.
Yes, there is one thing I'd like to bring attention to, and that involves the Medi gap. So you can always make changes, but outside of your initial enrollment period, when you first become eligible for Medicare, you can get a Medigap policy and are not subject to any type of underwriting. If you change from that Medigap policy or want to go back, in the future you may be subject to medical underwriting, which in turn will increase your premiums if you're not as healthy as some.
Okay, all right. So let's just touch a little bit on the Medicare prescription drug plans.
Yes.
So this is considered what, the Part D. So is this the time also that we're making that decision when I'm coming in to make that decision?
Absolutely. Now's the perfect time to shop, compare, and make any of those changes. We want to be sure that all your prescriptions are covered under your plan, and then you can also cost compare the different plans. Keep in mind, if you choose to drop Plan D altogether and you enroll later, you could be subject to a penalty. This penalty is currently 1% for each month you went without creditable drug coverage. So it can add up. You want to avoid all types of penalties. So with the Part D, make sure your drugs are covered right now, compare the cost, and then sign up for it.
Okay, great. How about, so let's sort of switch gears around the costs and the benefits. Okay, so you've touched a little bit on the cost. What are the differences in coverage between the plans that I might be considering? Like, what are the things that I'm kind of looking at overall and having to make the decisions on?
Sure. Keep in mind, original Medicare, nationwide, as long as they accept Medicare, that's all you care about. With the Medicare Advantage plan, we want to make sure your providers are participating. So Medicare Advantage plans, you may see some differences in the service areas, what's covered, the providers that are in network. To give you an idea, for 2026, we're going to be looking at 77 different Medicare Advantage plans to choose from.
That's a huge, and that's in Pennsylvania.
Yeah, and then
kind of in this local area.
Right.
Wow.
And then for the Part D, the prescriptions, I believe there's 12.
Okay.
So you do have options. It's very important to do your due diligence to make sure that everything you need will be covered under your plan.
Okay. So, so my next question kind of leads naturally into that. So if I'm making choices and I'm thinking about a Medicare Advantage plan or something else, making sure also if I want to stick with my doctor, that I actually need to make sure that my doctor is part of that participating group, or if I have a specialist or something, that they're part of that participating group.
Absolutely. Another thing to keep in mind is if your provider is going to be retiring soon.
Oh, okay.
Yeah, so you want to make sure that you have everything lined up, your hospitals, your providers. Also keep in mind with a Medicare Advantage plan, you may need a referral to see a specialist.
Okay.
With the original Medicare plans, you do not need that.
Okay. Switching gears kind of back to the medication coverage too, the Part D. Do the plans cover, so they actually cover the cost of the medications, and then is it that I have a copay with those?
Yes.
And okay. Can
So,
you talk a little bit about that?
Yeah, the interesting thing about Part D, so we have a couple things. There's 3 different levels of coverage when you're a prescription drug plan. Your first one is your deductible phase. This is where you're going to pay 100% of your prescriptions until you meet that deductible amount. For 2026, it's $615.
Okay.
So once you pay your $615, the next phase is your coverage phase.
Okay.
So there you're going to be responsible for your co-pays or co-insurance that your plan says that you are responsible for. Once you hit a $2,100 threshold for 2026, everything on your prescription drug plans will be covered and paid at 100%.
Okay.
So that's where we are. It got rid of the donut hole, if you remember that. So that's a little bit about the Plan D for you.
Okay. And then I'm kind of going to throw you a little curveball, but I think you're going to know the answer to this. PACE.
Yes.
So how does PACE, so I choose a Plan D, because I don't think we talked a little before this at all about PACE, but I do want to just address it a little bit. How does, if I'm picking my Part D for my prescription, like, does that mean that I'm not eligible for PACE? I can't get PACE? Like, what exactly does that mean?
Okay, so PACE is basically a cost savings program available to Medicare beneficiaries that qualify. With PACE and PACEnet, depending on your level of income, you get help with co-pays, your deductible. It's going to be an overall lower amount that you would be responsible for. Now,
so does that mean like my Part D pays sort of first some of my costs and then pay, or vice versa? PACE would pay some of my costs, and then whatever I would have would be covered, whatever's the balance, I would be covered under Part D?
Well, PACE is going to set the co-pays for you.
Oh, okay.
So when you qualify, and if there's any question as far as any of the cost savings programs, because there are 3 available to Medicare beneficiaries, at the PA Medi counselor, we can see if you meet the qualifications as well as help you apply.
Great. Great. Okay. All right. Some of this is it's a lot to know.
It is.
It's actually I feel like I need to also just make a point to the viewers that, you know, someone like Kristy she's a volunteer.
Yes.
You know, so her really, you know, you have to do your homework on this, and this is not just
Definitely.
You know, this is definitely a time commitment for a volunteer, and sort of a passion and liking to do things like this. But I guess you're always sort of helping individuals and sort of really, I mean, it's really helping them to make good decisions for them financially and for their health care.
Absolutely. I mean, healthcare today, there's so many options to choose from. And if you have somebody in your corner that can help you, like I said, PA Medi is unbiased. We offer the free counseling services to you. So anytime you have a question, please reach out. We're always there for you. I did bring a little information on what PA Medi is.
Okay.
It's a PA, stands for the Pennsylvania Medicare Education and Decision Insight. It's a state health insurance assistance program, also known as SHIP. We are a part of a national network that receives both federal and state funding to assist Medicare beneficiaries, and we have provided assistance to Medicare beneficiaries for over 30 years. So we're operated by the PA Department of Aging and delivered to the Medicare beneficiaries through the local area of aging. And we are the one of the programs that are subcontracted through them. So yes, I am a volunteer. Like I said, about 3 years, still so much to learn, and I love every minute of it because it is very challenging. Keeps me on my toes.
Right, because it just seems like there's not a one-size-fits-all for everybody. So really kind of getting that landscape and looking at what is best for all of those people.
Absolutely. And to do, now once a month, I do also offer the Medicare 101 presentation if you're new to Medicare. And again, just an overview for everything Medicare.
So the Medicare 101 presentations, do you do any of, are those available online at all too? Could they go on to like Berks Encore's website and view one? What could the
Okay.
viewers do if they wouldn't be able to attend one?
You know, I'm not sure if there is on demand. I'll have to ask Rosa about that. That's an
Okay.
excellent question. Once a month, we try and do it, usually around the fourth Thursday of the month.
Okay.
Now, with Thanksgiving in November, our next one is going to be November 13th.
And do you do those at the senior centers, at some of the different senior centers?
It's actually going to be at the Reading Hospital this
Oh,
month.
nice. Okay.
Last month was at St. Joe's. We try and kind of switch it up a little bit. We'll do the hospitals, and then we'll every now and then we'll do a Zoom meeting, so you can
Okay.
do it from the comfort of your home.
Okay,
So,
good.
but every month we do offer that
All right.
service.
So then they would have some capabilities through a Zoom meeting too.
Absolutely.
Even if there's not something you could pre-recorded that you would see, you could access a Zoom if they would call and kind of get a schedule then. the viewers
Sure,
could.
sure.
Okay.
Because at PA Medi, we could do an appointment one-on-one, face-to-face. We could do it over the phone, or we could even do it on a Zoom meeting if that works for you.
Great, great. So we've talked a lot about just sort of the plans and picking the plans. You've talked about PA Medi, how that program works, and sort of how that funding shifts down from the federal and state levels and comes down to provide the volunteer services. So are there any additional important points, Kristy, that you would have around making some of these? I guess one of the other questions I did have was around qualifying for extra help subsidies. So I know for some lower income individuals, there are some additional subsidies to help pay their Medicare costs. Could you just talk about those a little bit? And the reason why I think it's important that the viewers realize this is because, again, it's one more thing once you go to this counselor to really have and have some questions about. Come ready with what your income is and understand, and then they can help you understand. So
Sure thing. First, let me start. Even if you are not low income, I do have some tips to help you save money.
okay, great.
Because, you know, Medicare is expensive health insurance. We want to save it everywhere we can. Something you consider is shopping around for pharmacies. Price compare the different ones, Walmart, CVS, whatever it may be. You could reach out to your plan's administrator, see if they offer any type of discounts. Even to the big the pharmacy companies, do they have any free samples?
Oh, nice.
Anything that you can do really does help. Another thing that to mention that was introduced last year, again, it's not going to save you money, but it may make the year go smoother for you. It's the Medicare Prescription Payment Plan. And what this is, if you have high drug costs and would like to be more predictable in your monthly expenses when it comes to your prescriptions, this will actually break up the cost of your prescriptions over a calendar year, and you'll be billed monthly.
So it's sort of like when you have the monthly payments with your oil bill or something
like a
that,
budget.
and you're on a budget. Okay.
Exactly,
Okay.
exactly. So what they'll do is they'll spread out those high cost out-of-pockets over the year, and you won't pay at the pharmacy counter. You'll just pay, you know, when you get that monthly bill. Keep in mind that this is an optional program. If you were enrolled last year, you're going to automatically be re-enrolled. If it's something that you'd like to do, just reach out. We can set you up on that. There's no cost to be involved. I guess no cost savings. It's just the convenience of having it. So now with the 3 cost-sharing programs available to the Medicare beneficiaries, one we have is the PACE and PACE-Net that we spoke about. The other one that I really like is that helps you with the Part B premiums. That's the cost savings program. Again, any of these programs that you feel that you may qualify for, reach out to a PA Medi counselor and we can set you up.
So the cost savings there would be whatever you're paying for your premium that, you know, typically you get your Social Security income and your Medicare's pulled out of there, that cost. So that's the cost that where you would have savings, they would be taking a little bit less out.
Sure,
is
yeah.
what I'm understanding.
So PACE and PACE-Net, they're going to help you with your premiums, your co-pays, and everything.
With drugs, specifically with
drugs. PACE and PACE-Net is specifically Part D prescription drugs. Now, there is another, the cost-sharing program, which is that can help you with your Part B premium. You, as a Medicare beneficiary, will be responsible for the Part B premium, whether or not you have original Medicare or Medicare Advantage.
Okay.
So that's something to keep in mind as well.
Right. Okay.
Yeah, it's a lot. It is
a lot of
definitely a lot.
information. But what I'm hearing is, you know, there's some additional subsidy programs that people should look into based on income. And don't assume, I think that you wouldn't qualify, because you very well may. And I know this, I think it was this year or even last year, I can't remember off the top of my head, but they did increase the PACE. They did increase the PACE parameters, so more people are eligible for PACE and PACE-Net now.
Absolutely.
So, and that's a great program, because, you know, a lot of times it's a set copay then for each of those drugs. And then I guess the other thing I'm hearing is when you're coming in to meet with a volunteer, the things you should have really ready with you would be like the information, here's my doctors, here's my specialist, these are the medications I'm on, this is my income. Is there anything else you can think of that I'm missing that you would recommend that volunteers, or I'm sorry, that consumers would come in to meet with the volunteers and bring with them?
No, I think you covered all of it. Your Medicare card, your list of your providers, your hospitals that you like to use, and your prescriptions. As long as you have all of your bases covered, there shouldn't be any surprises throughout the year, hopefully.
Great. All right. Well, thank you so much, Kristy.
Oh,
this was a lot of information we covered in a short period of time, but we talked about this earlier and kind of scratching the surface and just getting people to know. If we could get the graphic up again for the contact information on Berks Encore, that would be great, so that we could see. This is their contact information. So Berks Encore, it's 610-374-3195, and they can help you there, point you in the right direction. Know that they have the volunteers available. You can go in, you can meet with them. They're also meeting at some of the different senior centers. Now's the time to call and make appointments, because they're booking quickly.
Absolutely. We have until December 7th to make these changes. We can help you do that. And we also do have some counselors that are bilingual.
Great. And so one last thought is open enrollment has started, correct. Already? So that has started, and you said it's over. You have to make your decisions by December 7th? Okay.
Yes.
All right. Well, thanks so much,
Thank
Kristy.
you.
This was great. And thank you for volunteering.
Oh, well, thank you for
really
having us.
Committing for this and helping out our older adults. I know this is a big job that you guys are doing, and it's really important for everyone. So.
I'm thankful that I have the opportunity.
All right.
Thank you.
All right. Thank you, everyone. Thanks for tuning in, and we will see you next month with some more important information on Aging Matters.